Examinees, you may now begin your patient encounter.
So she is Mrs. David, and her Rose, daughter Rose, 1 year old. I'm not stressed because this is a pediatric care, so you can take your time here. 3 inflammation, so respiratory, upper and lower, GI or gastroenteritis or urinary, those 3 inflammation, and skin and the membrane, and the skin and the membrane, which are meningitis. This is the differential diagnosis. She has fever. Okay, so the fever. Okay, this is the chief complaint. I'm going then the differential diagnosis, and then I'm going to review the local system and review of system, and then BDS and the others, and then here is the pediatric history. The pregnant women deliver neonate and the IC, and this is for counseling. Okay, Ms. Davis. Ms. David?
Yes?
Hello, Ms. David. My name is Dr. Mohamed Elawdy, one of the attending physicians in the office.
Doctor, I've been waiting for you on the phone for a long time. Where have you been?
Oh, I'm so sorry. I was in the emergency and I encountered unexpected delay there. I apologize again. Anyhow, I'm here available to you. So could you tell me what's going on?
Yeah, my child has fever and I'm a little worried about her.
Okay, I understand your concern. I'm going to do everything possible to make your child feels better. So how long has she have fever?
Since yesterday.
Since yesterday? Okay, did you check her temperature at home?
Yeah.
Okay, what was her temperature when you checked at home?
101 degrees Fahrenheit.
101 degree. Okay, so did you give her any medication for the fever?
Yeah, Tylenol.
Tylenol. Has the fever come down with the Tylenol?
It's only by half degree.
Okay, when the fever comes, does she have any sweating?
No.
Any chills?
No.
Is she alert or sleepy?
She is sleepy and weak.
Sleepy. Okay. Does she shake as if having seizures?
No.
Okay. Does she have any symptoms other than fever?
Yes, she also has cough.
Cough.
Yeah.
Okay. Is the cough worse at night or in the daytime or at night?
Worse at night.
At night. Okay. Does anything make the cough better?
No.
Does anything make the cough worse?
Yes, at night.
At night. Okay. Does she cough up any mucus?
I feel she wants to, but she can't.
She can't. Okay. Does she tug at her ear?
Yeah.
Okay. Have you noticed any discharge comes out from the ear?
No.
No. Does she have runny nose?
She has, yes.
Runny nose. Okay. Have you noticed any recent changes in her voice?
No, there's no change.
Okay. There is any difficulty swallowing or sore throat?
Yes, she has difficulty with breastfeeding.
Difficulty in breastfeeding. Okay. Does she have difficulty breathing?
No.
Any chest wheezes?
No.
Okay. Does she have any vomiting?
No.
Any diarrhea?
No.
Any abdominal pain?
No.
Have you noticed any signs of dehydration?
No.
I mean, like, does she or is she thirsty?
No.
Does she drink more water than usual?
No.
Okay. Does she burn while urinating?
No.
Okay. Does she pee more often than usual?
No.
Okay. Does she have any skin rashes?
I haven't noticed.
You haven't noticed. Okay. Is her neck stiff?
No.
Okay. Okay. So has she been around anybody sick?
She goes to daycare, but I'm not sure if she came in contact with any sick people there.
Okay. So a few questions about her health in general.
Okay.
Has she been sleeping well?
Yes.
Sleeping well?
No, because she coughs at night more often.
Okay. Does cough disturb her sleep?
Yes.
Okay. Has she been eating well?
Yes.
Eating well. Have you noticed any recent changes in her weight?
No.
No. Okay. A few questions regarding her past medical history. That's okay.
Okay.
Does she have any medical diseases?
No.
No medical diseases. Has she had any surgeries done?
No.
Okay. Does she take any medicine on a daily basis?
No.
Okay. Has she had a similar condition like that before?
Yes, I think 3 months ago.
3 months ago?
Yeah.
Okay. Does she have any allergies?
She has with amoxicillin.
Amoxicillin.
Yes.
Okay. With whom does she live?
With me and my husband.
You and her husband. Okay. Is she safe at home?
Yeah.
Okay. A few questions regarding Ruth's pregnancy, just to try to remember with me. Okay. Was her pregnancy a full term or preterm?
Full term.
Full term. Okay. As you remember, did you do check-up visits while you were pregnant?
Yes.
Okay. While you were pregnant, did you smoke?
No.
Did you drink?
No.
Did you use any street drugs?
No.
Did you have routine check-up visits?
Yes.
Did you have routine immunization?
Yes.
Okay. Did you have a natural birth or C-section?
Natural birth.
Natural birth. Did Ruth come out healthy?
Yes.
Did she feed well after delivery?
Yeah.
Did she have like yellowish discoloration of the skin or the eyes?
No.
Okay. A few questions to figure out her development. She is 1 year. Am I right?
Yes, that's correct.
Can she stand up?
Yes, she can.
She can. Can she say mom and dad?
Yeah, yeah.
Nice. Regarding what can you tell us about her immunization or shots?
Oh, it's up to date.
Up to date.
Yes.
Okay. Does she have routine check-up visit done?
Yeah, regularly, and the last one was a month ago, and everything was fine.
Everything was fine.
Yeah.
Okay. Miss David, do you want to add anything that I didn't ask?
Doctor, why is my daughter tagging her ear?
Oh, that's a good question. Okay, Miss David, I need to I need to discuss your case right now. Could you postpone this question until I discuss your case?
Okay.
Okay, this is your question. Okay, Miss Davis, based on the history that you told me, Rose is 1 year and she has fever since yesterday, and the fever was 100 Fahrenheit, and the fever came down only half degree with the Tylenol, and she tugs her ear and she coughs. However, she doesn't have any vomiting, no diarrhea, otherwise she is pretty healthy, no skin rashes, and there is no stiffness of the neck. Am I right?
Yes, that's correct.
And also there was a similar episode 3 months ago, and she is allergic to amoxicillin. She is safe at home and she lives with you and your husband. Am I right?
Yes.
And nearly her pregnancy was nice, and it was natural birth, and she doesn't have anything other than you told me. Am I right?
Yes.
So based on the history, it seems that she may have inflammation or infection in the respiratory tract, probably her ear, and it's common after the common cold. Okay, but as you know, I can't rely on the history alone. For that reason, I need to see Rose. I need to do a physical exam. I need to take her vital statistics. I need to examine her chest and her ear. I need to look at her ear, and probably we may need some blood works, and probably also may take some pictures of her chest. Okay, so I do recommend to see Rose as soon as possible. Is it possible to bring her to the hospital?
Doctor, I don't have a car right now, and it's so hard to get a public transport.
Oh, I understand your concern. Although Rose's condition is not so serious, but I recommend to see her as soon as you can. Could you call a taxi, or could you get a ride from a friend?
Okay, I'll try to do that.
That's nice. Back to your question, why she tugs her ear, as I told you, probably she has inflammation in her ear. However, I can't say for sure at this moment without having examination done. For that reason, I need to examine here. I think after examining here, I think I will be in a good position.
Minutes remaining.
I will be in a good position to answer you for sure.
Okay. I have some antibiotics left over from the prescription given to her brother. Can I just give her some of those?
It's a good question. I don't know if we are going to prescribe antibiotics to Rose or not. As you may know, that antibiotics are specific only for bacterial infection. Probably it's a viral infection, so I'm not sure if we are going to prescribe antibiotics or not. And even so, there are many kind of antibiotics, and each one is specific for each bugs or bacteria. So we may or may not prescribe the same antibiotics that you have. So I recommend not give her anything without examining her.
Okay, I understand.
Understood?
Yes.
So do you have any other questions?
No other questions, doctor?
Any other concerns, Ms. Davis?
No other concerns. Thank you so much for your time.
Ms. Davis, I'm glad to be your doctor, and as you come to the hospital, just ask about me. My name is Dr. Mohamed, and my bleep is 166, okay?
Okay, thank you.
I'm going to drop everything with my hand. I'm going to come to you.
Okay.
Thank you so much, and have a wonderful day.
Okay.
Thank you, bye.
Bye.
Thank you. Okay, this is a case of a child with fever. The mother of 1 year old female child is the source of information. Okay, the child has fever since yesterday that it's better with the Tylenol. Okay, Tylenol. Tylenol. Okay. And then about the fever, she is weak and sleepy, with no chills or fits. Okay, that's nice. Now this is the fever, which is the chief complaint. Going now to the cough. Also, she has mild cough that gets worse at night with little mucus. Okay. Okay, now I'm going to for the differential diagnosis respiratory. Okay, she has rhinorrhea, dysphagia, and balls her ear. Okay, about the lower respiratory, no dyspnea, chest wheezes or chest wheezes. Okay, wheezes. Okay. This is for the chest. Now the GI, no abdominal pain, diarrhea, or vomiting. Okay. For urinary, no urinary frequency or dysuria. No skin rashes from a new phrase. No skin rashes. Supple neck with no seizure. GI seizures. Okay. Now this is differential diagnosis. Local system, I think we discussed that. No dyspnea or chest wheezes. Okay. Second was is review of system. Appetite, decreased appetite, difficulty sleeping in view of sleeping, in view of cough, okay, with no recent changes in her weight, WEI, okay, in her weight, okay. She is breast fed with no special formula, okay. Now the past medical history, similar episode 1 month ago or 3, I don't remember, ago, that was cured of otitis media, like query otitis media, otitis media, okay. Similar episode, medication, she takes all Tylenol, allergies, amoxicillin, amoxicillin. She lives with her parents and stays at home, okay. Going to the pediatric history, pregnancy. She is a product normal or full term pregnancy, normal delivery. She can say mom and dad, okay. I think she stands with support, okay. Immunization is up to date, nice, up to date. Regular check up visits. The last one month, I think, 1 month ago, that showed normal height, weight, height, weight, height, and other developmental. As you see, it is done now, because for the criteria can make it up, and the other that's done, okay. I should, if you want to continue, you should delete, okay. I'm going to write this one, okay. And other normal developmental milestone, normal milestones. You see, it happens only on pediatric cases, because the history here is so long. If I have time, I'm going to just complete my patient note. I'm going to return it back, okay. Not done, okay. Here, otitis media, okay. This is the first differential diagnosis. The second one is going to be lower respiratory tract infection, bronchial asthma. I'm not sure, but this is persistent cough at night. You can write bronchial asthma, okay. Although it's far, just I'm writing third diagnosis. And here I'm going to complete those first. The first thing should be written is fever, okay. So fever, right? Number 1, fever. Second one has probably common cold, okay, because rhinorrhea, common cold because of rhinorrhea and sore throat. Can write here common. You can bring the data from up. She has dysphagia and rhinorrhea, okay. This is signs of common cold. Also, similar episode 3 months ago. The rhinorrhea, otitis media, yes. Similar episode. I think did 3 months ago. Okay, yes. 3 months, and then
there are 2 minutes remaining.
2 minutes. I'm fine. Okay, Margaret's at 9, rhinorrhea, and okay, what is? I didn't write it. Okay, I should write here. She pulls her ear. Oh wow. Okay, I'm going to return it back. Okay, she Okay, she pulls her ear. Okay, fever, copy fever, put it here. Also common cold, copy the common cold. Okay, and she has cough. Okay, bronchial asthma, you can write here persistent cough, especially at night. Okay, I'm going to write here in the workup physical and ear exam. I write CBC with the differential and chest X-ray. I'm done now. I have 1 minute. I can return now to the history. If I have to take out you know, this important thing to put important thing, but it's not bad. Okay, safe at home. Okay, can take for example shows normal milestones. That's nice. Okay, that's no bad. That's rain rates, Fiji, and the pulse her ear. I wrote it. Okay, that's nice. Okay, so okay, this is the history. No examination. There is no physical examination in pediatric. Otitis media, fever, common cold. Similar episode 3 months ago. She pulls her ear, lower respiratory tract, fever, also common cold, cough, bronchial asthma, persistent physical examination, CBC. Okay.
Your time is now complete. Please stop writing and click submit.